meeting. It was initially put together specifically for this suitability public meeting as relates to our agreement with the property owner, and so that you won't see the same schedule that we usually have. Let's see. So this evening, our first agenda item then will be to conduct this public meeting to discuss, make a suitability determination. The end of the hour, the select board members will take a vote. The way we'll do this is that we will invite representatives from Lowell House to tell us about their proposal for the property. We will allow, and I would ask that we keep that to about 20 minutes. And after that, we will allow board members to ask some questions and hopefully keep that to about 15 minutes. I would like to reserve at least 10 minutes for public comments and questions. This is not a hearing. We are not required to have public comment, but this is Reading and we welcome public comment. So we will reserve at least 10 minutes. And I would ask in advance that as the town manager allows you to join the meeting, to keep your comments or questions brief. And they also must be very narrowly focused on the suitability of this operator to operate the business as described to us tonight. As I said, this is not a hearing. It is a public meeting with a very narrow focus. And I would also like to make clear at the end of this meeting, when the select board votes on the suitability of this operator to conduct a business as described, it does not mean that, like any other business entering Reading, that they won't need to work with fire and the police and the building inspectors to flush out and build out the property in accordance with all applicable zoning and et cetera, all building regulations, excuse me. So with that, I would like to welcome Lowell House. Thank you for coming to our meeting, and I would love for you to let us hear more about your plans for the property at 59 Middlesex.
Karen, before we start, Karen, can you just identify for the public the members of the board, just so everyone's clear?
And I did do that before you joined.
Oh, sorry.
Okay, not at all. Thanks for keeping us on track. Okay.
Okay. Thank you very much for inviting us. We had a wonderful meeting with you. I guess that was about 2 weeks ago. And we thank you for your courtesy, for listening to us. And we are very excited about working with the people in Reading. It's been a pleasure so far. So I want to introduce you to the members of our team. Then I'm going to put up some slides. I want to show you a little bit about Lowell House and talk a little bit about our history. The next person that will speak will be Diana Newell. And Diana is our Executive Vice President for Integrated Care. Diana's been with us quite a few years, and she's going to talk about the actual program, what goes into it, why it's important and significantly important to the community, but also important to the state and the entire area. So we're excited about that. We have several other members of our team here. And I don't know where he is on your screen. Matt Brown is our Executive Vice President of Operations. Matt does a lot of our quality assurance work, our contract work, and operations of the agency. It wouldn't function well without Matt around, so we're very lucky to have him. We're also joined tonight by a neighbor at our Zach's House program on Pawtucket Boulevard in Lowell. A beautiful house. We're just adding an apartment program to that for young men, and that's the former fire chief in Lowell, Jeff Winward, and Jeff is a neighbor of that house. So I hope we can take a couple of minutes and let Jeff speak about a neighbor's perspective. We also have Leanne Maldonado. Leanne is a former client of ours and is now a staff member. She's come a long way and just a wonderful person that we've seen go along a terrific route from a very difficult life to some great success. So we'd like to have Leanne here to answer any questions and talk about what the programs are like to her. And then we also have Victoria Nesto, and Victoria Nesto is our interim residential director to go for Diana, and also is the program manager at our beautiful new Tower Hill program. So, and we'll show you that in a minute. So did I miss anyone? So I do want to take a second and introduce Dan Botwinick to you. You all know Dan, I believe. And Dan, if you can take just a minute or two to talk about your agreement with the town, and then right after that, we'll get into our presentation. Bob, okay.
Got it. Okay, can you guys hear me?
Yes.
Oh,
He's muted again.
now we can't, Dan. I think you've been muted. Oh, there we go.
How's that?
Yes.
All right. Yeah, so thank you guys for organizing this meeting. I met with a lot of the neighbors in the town about 1.5 years ago to have a discussion about a program that was going to propose a somewhat similar use, and that was before the pandemic, and obviously life is very different now. 18 months later, as we're coming out of it, but I thought that program had a lot to offer, and I'm also very excited though about partnering with the Lowell House for this particular program. So at the end of a process of discussing things with the town and arriving at a resolution to that action, we have an agreement for what's called a reasonable accommodation, which allows us basically the right to allow this type of use to occupy the property, subject to a suitability hearing, which is what you guys agreed to do tonight. So I look forward to the Lowell House getting to kind of explain a little bit about what they do and how their program works, and how they hopefully will be able to help a lot of people in the local community and beyond. And appreciate the opportunity to do this and get a chance for the neighbors to meet the team and ask questions. And at this point, I'll turn it back over to Bill and Diana and the other folks at the Lowell House.
Great, thanks very much, Dan. I'm going to go back here a bit. Sorry about that. I want to talk to you a little bit about Lowell House. I joined at Lowell House just 8 years ago, and I'm very pleased to those have been amazing years. We've had tremendous growth. We are a 51-year-old agency. We had a big party planned last year for a gala for our 50th anniversary. Did not take place, so we will do our 50th anniversary in our 51st year. We are a $6 million agency. We have basically really kept our work to the greater Lowell area, and this is our first expansion into really surrounding areas directly outside of the greater Lowell area. So we want to talk about our program. What you're seeing there is our Tower Hill program. And if you did a tour, and we have open houses coming up, we'll tell you a little bit about that. But if you took a tour of our buildings, you'd say, wow, these are wonderful places. So when we saw the nursing home in Reading, we thought, what a beautiful house, what a nice location. We want our clients on the way back from what's been very difficult lives for them to understand what their goals can be, what their recovery can bring to them. In fact, one fellow in this house approached me when I was there a few weeks ago and said, I can't thank you enough. Being in a place like this, and we call it Gatsby because it's really a mansion, really helps my recovery and helps me feel that I can achieve something very special in life. And I've never felt that way before. So again, Lowell House is run beautiful properties. You can see in the back of me is our clinic. We just finished that 1.5 years ago. We raised over $2 million to build this beautiful clinic right next to Lowell Community Health Center. So we have very special locations, but it's really what's inside the locations that's most important. So our mission statement, I think, is very clear. We tried to make it one sentence that could capture who we are and what we do. And it reads, Lowell House Addiction Treatment and Recovery assists people and their families to rebuild their lives and strengthen our communities by providing the resources, direct supports, skills, and freedom to live a purposeful life of recovery. And that purposeful life of recovery was very important to people. Not only to just recover, but to do something with your life, hold the job, raise a family, do all the things that we come to value so much. We are basically defined by 3 basic concepts. We have a focus on addiction, prevention, and recovery issues. Now, that related issues was hard fought in the beginning for us because we were strictly a 12-step agency when I first joined. We are no longer a 12-step agency. We're very expansive in how we think. And we've added mental health to our services. We are a licensed mental health center because we found that most of the people, about 70 to 80% of the people we deal with in recovery have mental health issues. They're co-occurring, and unless we deal with both issues at the same time, people just don't get better. So that was very important to us. We do services across a lifetime. We have people now that will be 13 years of age. We've had people as young as 10 or 12, all the way to people in their 90s. So addiction is not a disease that goes away. People fight it a lifetime, and we want to be there to help them with those fights across a lifetime. And we are community-based and very client-focused. We need to emphasize at the very base of addiction and mental health disorders is loneliness. I saw the former U.S. Surgeon General speak about this, and they found that loneliness, which is defined by 20 minutes a day of to battle loneliness, 20 minutes a day of actual physical contact with another human being. So many of our people get isolated because of this disease, is deadlier, more deadly than 13 cigarettes a day. So loneliness is something I would say is the very heart of addiction. Our programs range, and one of the things we wanted to do is build a complete continuum of services. So we do have residential, clinical, housing supports, case management, peer recovery programs, education and driver alcohol education programs, now called MID, and prevention and diversion programs. So we pretty much cover the range. The only thing we don't have is a self-standing mental health clinic, but we do provide mental health services. So in looking at that, we have the Men's Recovery Home in Tewksbury, which is a residence for men 18 years and older. It's a recovery home with a stay of about 6 months. We have the She and Women's program in Tewksbury. It is the oldest and most expansive program for women with addiction difficulties. The majority of our women are middle-aged and have no other programs, and this program has absolutely been miraculous. Our latest program is the Tower Hill program, and like our program in Reading, it deals with co-occurring enhanced issues with people with co-occurring enhanced disorders. Diana will describe that in some detail. Hybrid, we have Zach's House, Zach's House, which is in Lowell. Clients pay rent there, but we also have case management services, and they live there, about 10 clients. We just added an apartment program because one of the issues we're looking at is how people transition into the community and become part of the community. So they can go from congregate living now to an apartment program and then go out into the community. I'll show you our open houses at the end of our presentation. Saving Grace, which is a beautiful house. You can see it in the background there. It's a little hard to see. Again, a gigantic Victorian in Lowell, beautiful house, and that supports 11 women in recovery in a sober house. And we also have our men's sober house in Lowell called the Hanover House. We have housing supports, case management. We have, as I mentioned, community supports. We have our behavioral health community partnership, which is part of Lowell General and deals with people that are frequent users of the system, high-end users of the system. Our co-op outreach program. We have a peer recovery program. I'll show you that in a minute. Our MOUD outreach and our MID second offender program. We are very much an outreach agency involved with the community, involved with people who live in the community. We then have our outpatient clinic on Jackson Street. We do MAT programs, medicated assisted treatment. We have psychiatry in conjunction with a partner, Column Health. And we have our structured outpatient addiction program, a 6-week program for people in early recovery. So we really do run the gamut, as I mentioned. Our Recovery Cafe is a very unusual place, one of 7 in the country. It is a place for peer recovery, peer-to-peer recovery. If you want a latte any day, we serve lattes at 1 o'clock in the afternoon. It is I think Rich would say, a place of love and caring and support. Unusual, it is not a treatment program. It's really a place for people just to heal and get better. So we're very proud of that. One of our concerns has been for quite a while the mental health issues that have been growing among adolescents and children. The suicide rate is up, and just yesterday, or the day before yesterday, in Forbes magazine, I happened to come across this article about the Colorado Children's Hospital that declared a pediatric emergency following a 90% increase in the number of people that wanted to access the hospital over the past 2 years. We are in, again, the pandemic really shadowed a lot of this. We are in a tremendous crisis with our children. And they're not just children in poor situations. They're in every household, every income bracket, every racial and ethnic group, where mental health and substance use has become just an incredible crisis, its own pandemic. So I'm going to give this over to Diana, and she's going to talk a little bit about co-occurring disorders and about our program. So Diana, you just tell me when I need to shift the slides.
Thanks, Bill. I'll let you know ahead of time here. You're probably going to see my mouth move and not hear my words until a little bit afterwards. I live out in the sticks, so I'm working with satellite internet here. So everything's going to space first. So excuse me for that. But so what this program is going to be is what's called a co-occurring program. And co-occurring disorders, or dual disorders they're called, sometimes they're called dual diagnosis, are basically describing people who have a substance use disorder as well as a mental health disorder. And as Bill said, pretty much 80%, sometimes even more, of the people who have substance use disorders also have mental health disorders, and vice versa. People with mental health disorders very often have issues with substance use. We very long have had what we call co-occurring capable programs. Those have been the norm. We have multiple programs like that. The men's recovery program Bill mentioned, the Sheehan program for women. Those are co-occurring capable. So they can take people who have dual diagnosis, but we recognize that people with more significant mental health issues needed something more. And that's when the state put out contracts for co-occurring enhanced, so that we can serve people with more significant mental health disorders. Next slide, please. So basically the differences with these co-occurring enhanced programs are pretty significant. The staffing level is much higher, and this is what this program that we're going to talk about that's going to be going on Middlesex Street is. It's a co-occurring enhanced program. So it has a greater level of staffing. There are medical staff on site, which is different from other programs. Psychiatric services are required, and it's required that they be on site for part of that time as well. A much higher staff to client ratio. The case managers and counselors have to have higher credentials. Everybody that's a case manager in this program is going to have a master's degree at a minimum. There's going to be a greater level of supervisory staff. The programming is much more intense in all co-occurring enhanced programs, but with adolescents, it's going to be even that much more so, because with adolescents, you got to keep them really busy, as anybody out there who's a parent knows. And also with this adolescent program and the other co-occurring enhanced programs, the capacity is smaller. The maximum number of clients is set, and it's a much smaller number than the co-occurring capable programs are. Next slide, please. So this is Tower Hill. That was the picture on the very first slide that Bill showed you. The beautiful mini mansion that we like to call Gadsby. And this just tells you a little bit about what that program does. It was our first co-occurring enhanced program. You can go to the next one, Bill. Next slide, please. Thanks. So, as Bill said, everybody in this country has been recognized. Nope, you can go back a little bit. Everybody's been recognizing, the problems that have been occurring with young people. It's been happening over the last several years, and with COVID, it's really escalated the mental health needs of our young people. So BSAS, which stands for Bureau of Substance Addiction Services, and they're an arm of DPH, our Department of Public Health in Massachusetts, put out these RFRs, which stands for, in case you don't know, some of you probably do, request for response. And they put out these contracts for these programs, one out in the western part of the state and one in the eastern part of the state. And it's the one that in the eastern part of the state, which is co-ed, which we received the contract for. So this is a state contracted program, and it is licensed by the state. You can go ahead and go to the next slide. So basically the long-term goal of this, anytime they take a child out of their home, we want it to be as short as possible. For those of you who are parents, I'm sure that you've had your own struggles with children. I have kids, and they're adults now, and it wasn't an easy journey all the time. It's a wonderful journey, but it's up and down. And, the goal is to get them stabilized and get them back home with their parents. So it's not meant to be a long-term program. Hopefully it's not going to be longer than 90 days. It could be because it's individualized treatment. So it will depend on what the kids need. But the goal is to stabilize them and to provide a seamless reintegration back home to the family, to the community. We're going to provide assessments and do referrals back to the community, because these kids are everybody's kids. They're kids that live in my community, they're kids that live in your community, they're kids that live in Bill's community, they're kids that live in all of our community, and they're coming back home, and we have to help them do that. Next slide, please. So the admission criteria is based on a couple of things, and it's very specific. So we go by the DSM, which is the Diagnostic and Statistical Manual of Mental Disorders, that comes out from the American Psychiatric Association. That's the mental health side. They have to meet the criteria for a mental health disorder. The other thing they have to meet is a level 3.1 that's determined by ASAM, which is, sorry, dog barking. The American Society of Addiction Medicine. And it's the type of, it's the level of care. And there's 6 dimensions and criteria that they have to meet for that. So it's very specific, and we do specific assessments so that they meet each of these criteria. Next slide, please. So this program is going to be the first of its kind in Eastern Massachusetts. It's actually going to be the first of its kind at all. So it's going to be affiliated with the Beverly Recovery High School. I don't know if people know what that is, but there's 5 recovery high schools in Massachusetts, and they are specific for kids that are in high school that have had substance use disorder problems. So if there's a high school child who's had a lot of issues with substance use, and they're going back to their regular high school and they continue to have difficulties, they can go to these specific schools that can dovetail their treatment and their clinical needs with their education. They're really pretty special places, and there's only 5 of them in the state. So we're very lucky to have one only 11 miles away from Reading over in Beverly. So we're going to be serving multiple agencies and individuals, including obviously DCF, DYS, DMH. Schools can refer families. This is going to be a multi-referral program. Kids will come from anywhere. Kids can come from Reading. Kids can come from Wilmington. Kids can come from anywhere in the area. The ages are going to be 13 to 17. We're hoping to start with 9 females and 9 males. And basically, we're going to be serving kids that are presently being served out of state because there really isn't any place for them. And nobody wants to see their child going that far away from them. You know, the point is to try and keep them as close to home as possible so that they can get a good transition. And also, we're going to be serving some kids that have fallen through the cracks right now. Next slide, please.
So this is the,
So these are
this
some
is the,
pictures.
go ahead, Diana.
Some of you may have been inside, and some of you may already know this. This is the picture of the front of the Daniels building as you know it. And what we'll be doing is a lot of renovations. We already have had an architect go through, and it's going to be important to us to update some things and make it as child-friendly as possible. You know, Bill talked a lot about in the beginning about the types of, you know, houses that we choose. And that's a really important piece of it. When people have to be out of their homes, whether they be kids or adults, and be in treatment as it is, that's hard enough. So we try to make them as home-like as possible, and make people feel comfortable where they are.
So we just want to invite you. We do have two open houses coming up since our Tower Hill program in Lawrence just opened up. And this is on our website, lowellhouseinc.org. We'd love to have you there. You can talk to some of the neighbors in that area. You can see the program, meet the staff. It's a similar program. It is adults, an adult male, but it's a similar program in terms of what the curriculum does, the type of population that's there, and it's just a great group of men. The men will will help do the tours, and I urge you to come and join us for that night, get a chance to talk to us a little bit, talk to the neighbors, talk to some of the men in the program. And then our Zach's house, which we just opened up, beautiful 2-bedroom apartment program. It's actually in the garage to the right. You can see it there. That's on Tuesday, June 29th. Love to have you come there and see that program. Again, beautiful house, beautiful location. So help us celebrate. Come and join us.
I want to just mention a couple other things real quick. You know, people are always concerned about this, and it's important to note that this program will be licensed by the state. It will be audited by DPH, BSAS. We will also have to follow regulations of DEEC, which is the Department of Early Education and Care, which oversees all children's programs. It will be, as I mentioned, very well staffed, very low ratio. Well, actually high ratio, low kid to staff. It's 24 hours a day, 7 days a week, on call, hierarchy of administrative folks above and beyond the folks that work right in the program. I am personally 24 hours a day available, as is Victoria and several other levels of staff throughout Lowell House to this program. You know, no child walks away from the program unescorted. You know, those are the kind of things that, you know, we do find people get concerned about. The insurance companies also audit us and license us and credential us even more stringently than the state does. So there's a lot of oversight.
The regulations are extremely extensive. If anyone's, you know, wants to look up what they are, they're online, and they're open for anyone to review. But it's very extensive and very specific, and covers virtually every aspect of what we can do with the folks who'll be living there, as well as requirements for staff training, staff certification, and the ratios of staff in the program 24 hours a day. So it's, and like Diana said, the insurance, they have additional requirements on top of that. And internally, we combine both, as well as our own best practices, and do our own reviews and audits to make sure that our programs are all above and beyond what the minimum compliance is.
We had a question about JACO, and I've been through JACO a number of times. I work for hospitals and healthcare centers. It's a 3-year paper chase. Our funders, our licensing people are there on a regular basis. They do annual audits. We are very closely monitored, and for quality, submitting all our quality statistics on a monthly basis. So I think you'll know, and we feel strongly that the oversight is really very strong in our programs, in all the programs, but especially in this one.
Thank you. I appreciate that. And thank you, all of you, Matt, Diana, and William, for explaining that and for sending over that presentation in advance. It was very helpful. At this time, I'd like to open up this meeting to questions from other board members. Carlo.
Thank you, and thank you, everyone. Great presentation. You mentioned 90 days, and I was curious, and I think I heard somewhere 6 months. So is a typical, I know this is the first one of its kind in Eastern Mass, is it a 90-day minimum stay up to so many months, or after 90 days you assess the team and then determine with the families and whoever else you use for guidance if more time is necessary? Is it a minimum of 90 days and then up to, or is it up to a year, or is it, I know it's hard to answer because you haven't done it yet, but maybe there's other states that have done it.
Yeah, it's a little difficult to answer at this time. They're going on a 90-day model. What the insurance companies do is they give us 90 units to start with, but it is based on individual treatment. We're finding that this type of program is running around 6 months. However, because these are kids, and the most important thing is for kids to get back to their families and their school, because we're going to be doing education, but it's going to be based on what's coming from their home school system if they're not in the Beverly High Recovery High School. So the goal is to be getting them back as quickly as possible. So we're going to be shooting for the lower end. We're really going to be working hard to transition them back, but a lot's going to depend on the acuteness of their needs.
No, thank you. And the Beverly High School recovery aspect, when would that begin?
Well, we're going to start the relationship with them right away. And so it will be a combination of working with them. We'll have a full-time education coordinator working with us, who will be the liaison with the home school system of each child. So it'll be the team of our education team, the home schools team, and Beverly High School to determine whether or not a child is appropriate for the Recovery High School. So each child will be looked at for appropriateness for that. And if they are appropriate, they'll be able to go there. And we will be doing the transportation for that each day.
If I can just mention something, I think Matt is attempting to answer some of your questions on the chat. If you can just say them to us so everybody can hear them. It's a little difficult to read the chat sometimes.
So correct. So questions coming from non-members of the board at this time, we'll wait till later on in this meeting and we will get at them. But thank you for sending them in. Clearly people could see them in the chat. Okay, other board members, Mark.
Thanks, Karen. Thanks, folks. I have a number of questions. I'll try to kind of roll through them. Most of them are general, but a couple are specific. To start, you talked about on-site supervision. You talked about 24/7 on-call services. I'm wondering what the residential services are during, I guess, non-traditional hours. Are there people there on a regular basis? Is it a substantial staff? Is it medical? Can you tell us more about that, please?
Sure. We have a full-time nurse. As I said, we'll also have full-time psychiatric services on site. So the ratio is a 1 to 3, which means for every 3 kids, we have 1 staff. So if there's 9 kids, there's 3 staff. Outside of that ratio, in addition, we will also have 16 hours of every single day, 7 days a week, a master's level counselor. And then that's in addition. We will also have 2 recreation therapists who will be doing the recreational planning. That's in addition and outside of the ratio as well. So there's a number of positions, like we'll have tutors for education. That's above and beyond the 1-to-3 ratio. So at any given time during the day, there could be 10 or 11 staff there. 3 are considered in ratio with the children and can never leave on site with them. The others are additional programmatic staff. They're either there as clinical staff, recreational staff, educational staff. One of the most important things with kids, as everybody knows, is to keep them busy, especially these kids. So the programming is going to be pretty much 12, 14 hours a day from morning till night. It's going to be structured the whole time. Either they're going to be in groups, they're going to be in school, they're going to be in a recreation class, they're going to be in arts and crafts, they're going to be in something. It's going to be structure. Very little free time. They will get free time because kids need free time. They need some downtime. They need to be able to just hang and maybe play a video game. But there's not going to be a lot of that because you got to keep them busy. So I hope that answers what
Can I
you're
can I
looking
just
for.
add to that, so no one calls if they don't see that many cars in the parking lot overnight. The ratio does drop during the overnight hours. I don't know if Diana, what's the number for that? So if you see fewer cars in the middle of the night, it's not
1 to
because
5.
1 to 5, yeah. So just and that's because hopefully people are sleeping, and we will have some obviously the people are going to be doing rounds, monitoring, but we're also going to have some technology at the program to make monitoring a little bit more easy and to ensure the safety of the program as well as the neighborhood.
Super.
Mark, we're going to try and keep our answers short because I know you're time limited. So.
Yeah, so sorry, I've got a pile of questions. So I know that at Lowell, so you've got a local constituency and you've built up support services and other activities kind of surrounding the facilities. Is that your intention here in Reading as well?
Absolutely. That's a huge piece of what. I'm sorry, did you want to answer it, Bill?
No, you can answer it, Diana. You're better at it than I am.
A huge piece of what we do in all of our locations, we're in Tewksbury and Lawrence and Lowell. When we went into Lawrence, the first thing we do is become a part of all of the groups. We get to know the police, the fire chiefs, the recreational people, our neighbors. Over at Zach's house, we have a couple of barbecues a year with our neighbors. And we try to do that everywhere we are in a residential area. So we would get to know the people over across the street at the public library. We'd get to know the people in the recreation department. We want these kids to be as normalized as possible. And, communication and relationships are the most important thing. So we want to be as transparent as we possibly can and get to know people. We want people to know us.
Great, thank you. So one of the groups you'll want to get to meet in Reading is called the Coalition. I don't know if you're familiar with them already, but that's a group you definitely want to be spending time with if things proceed. I have a more specific question related to, you talked about certifications and supervision in various groups. And I know that DPH, Department of Mental Health, Bureau of Substance Abuse, I assume that you are licensed with all these groups already as a result of your work at Lowell House. And is all that in order? Have there been any revocations or suspensions?
It was a requirement to apply for this RFR to have those licenses and be in good standing. So all of our licenses are in good standing and have been well maintained for years.
Great. And so no revocations have taken place either. Great. Sorry, I'm trying to fly through, Karen. I see your look. You talked about ratios, great. Stay, on-site supervision, the local constituency, coalition, certifications, regulatory. Let me pass the talking stick. Thank you.
Thank you, Mark. We appreciate your thoroughness. Anne.
Thank you very much for the presentation. I had a question about the mechanisms through which children are placed in the program. Is it voluntary on the part of families? Is it court ordered? Are they DCF placements? Is it all of the above?
It's pretty much all of the above, but it's really not. I mean, I guess you could consider it a court mandated if it's if the child is in DYS. But for the most part, it's you know, it's a treatment team getting together
Okay.
and deciding that this is the best place for the youth. You know, it's not like with adults. All of our adult programs are voluntary. I doubt you're going to find too many children that say, yes, please, I want to go. So it's not really the same kind of setup. You know, children are not going to be too happy to be taken from their homes.
Right.
But it's where the treatment team gets together and decides it's the best thing.
Okay.
Yeah, and a lot of it, Dan, is how we involve the families and the community in doing that, that can make it more comfortable for the child.
Okay. So the only situation in which it's a commitment really is in the context of a DYS placement. Okay. Thank you.
Chris.
Thank you, Karen. And thank you guys for the presentation. I had the fortunate or unfortunate phone call with a resident of Reading, obviously, that his son is actually involved with DXM. I don't know if you guys are familiar with that. It's a substance, it's a cough suppressant that teenagers are abusing recently. And I'm just wondering if that's something that you guys end up dealing with, is seeing those kind of cases. And then my other question is there any plans for security cameras? Is that part of the, so there is for that. All right. So yeah, if you could answer the first question for me.
We work a lot, Chris, with our partners in the community. We're not all that familiar with some of the partners in the Reading area, but we will be. In answer to the questions, yes, our IT people have gone through there. We'll probably have more cameras than any program we currently have, and also respecting privacy. But when we do that, we also have to secure the safety of every student in there. So that's extremely important. So yes, there'll be quite a few cameras, both in and out.
Okay, perfect. Yeah, so the DXM thing is just a substance that people are abusing. It's not like a group or something.
Oh, I'm sorry. Yes, you're right.
Yeah.
Okay.
Yeah, so basically it's over-the-counter stuff that kids are able to buy right at CVS. And I checked beforehand and it's all out of stock at all the CVS's, even around here and all that. So it seems to be out of stock for a reason, which is very unfortunate. So hopefully some kids can get the help that they need as well. So
yeah, Chris, it's absolutely astounding how many things personnel turn into street drugs, but also the capabilities, especially of adolescent populations, of shifting back and forth and really moving around the adults in a lot of ways. So yes, we watch those things very carefully. We're concerned about things like marijuana in youth and the strength, the THC strength of marijuana. I mean, there are so many concerns, but it's getting kids into sobriety, keeping them busy, and basically helping them feel better about themselves.
I'm not a clinician, but I know from enough codes in the DSM-5 that there's some flexibility if someone has an addiction to a substance that's not what we consider a substance. There's enough wiggle room for a clinician to make that diagnosis for them to reach the ASM level they need to be in this program.
and then my final.
Absolutely, especially for kids. We have so many varieties of things that kids are coming up with. You know, as everybody who goes to the pharmacy sees, you know, right now you can't buy more than one package of Benadryl because that's a big thing right now, is they're crushing those up and snorting them. So there's always something new going on for young people.
And coming into the program, there's usually a lot of co-occurring issues going on, and that's just one symptom of some of the issues going on. So.
And then in regards to the ages, so it's 13 to 17, does it go outside that, like 18, or what happens, like 20, 21, or it's 13 to 17?
It's 13 to 17, but if someone comes in at 17 and happens to turn 18, then we assess that. If they're still in treatment and they happen to turn 18, they'll finish treatment.
And then I wouldn't want to believe that at 13 kids are actually doing this kind of stuff, but it really is happening to end up needing something like this to exist. Like, it just
My
seems
son
very
is a-
hard to accept that children are doing this kind of stuff, unfortunately.
My son is a middle school teacher, Chris. It's absolutely scary. I mean, the percentage obviously is lower, but still there's a number of children, even in the 5th grade, experimenting with drugs.
I don't want to, yeah, I feel very, very bad for people like that, unfortunately. So, all right, thank you, guys.
Okay, thank you, Chris. Okay, so at this time, we'd like to, there have been people patiently waiting in the waiting room. Bob, could you let us know how many people, how many members of the public have joined us? Initially, we were at 10.
Karen, right now, no one's in the waiting room, but 11 people have joined your meeting from the public.
Okay.
And right now, Heather Klisch is the only one with a hand raised before you even asked.
Okay, great. Perfect. So let's, okay, so in terms of the hand raise, there's a function in the Zoom. I mean, if that's not working, you can definitely wiggle your fingers. But we're trying to use the hand raising feature at the bottom of the screen. And Bob will let folks in order. So at this point at 7:51, and I would just ask folks to be as brief as possible so we can maybe get to everybody who joined us who would like to have a comment or a question regarding the suitability determination. So thank you.
Karen, do you see the hand raises in the order that they've asked? Do you see that, or should I tell you?
No, I would, I do not see them in the order, so I'm going to rely on you to do the best you can.
Okay.
To let people in order. They've
So
raised.
first is Heather Klisch, and I'll have to find you, Heather. There you are.
Okay.
So Heather, I'm asking you to unmute now. If you can unmute, they can hear you.
All right, I'm unmuted.
We
There,
can
good
hear
test
you.
case. So I want to thank you for the thoughtful presentation, and really thank you for the work you're doing. And thanks also to the select board for asking many of the questions I had. I have just a few more, a couple of which are for the select board, and I'll just run through them. One is that thank you for the overview that this is about assessing the suitability. And I'm wondering if there are criteria or measures that the board is using to assess suitability, and or if there will be conditions placed on this such that if things don't work out as we expect them to, what would deem it unsuitable? Let me see, I'm just going to run through these. And then another question I have related to that is, can Lowell House, can the operator change the use without coming back to the select board for an updated decision suitability? My other questions are probably way more boring. Well, one of them is, these are teens. The Daniels, I still call it the Daniels house. The property over on Middlesex doesn't have what I would call extensive grounds. And I'm assuming it's really good for kids to go outside. And I'm wondering what your plan is for that, if they go off-site and if they'll be supervised off-site, how you handle that. And my last question is, how many staff total are there at one time, and where do you intend to have them park? It sounds like there will be a bus there as well. And is there enough space to house all that on site? Those are my questions. Thank you.
Excellent. Okay, so if it would be okay, thank you, Heather. I think it might be a best approach for the folks from Lowell House to sort of note these questions. Let's hear what questions we have, and perhaps you could respond to some of them, or we will, perhaps they need to be redirected to someone else. Okay, so do we have somebody else with their hand up, Bob?
Yeah, there's a number of people. Do you want to have all the questions first then?
Do that. Let's have the questions, comments first.
Okay. The next person is Nicole's iPhone. And Heather, we can find out where you live. We know you. But Nicole, could you state your name and your address? And I've asked you to unmute. You should be able to do that. Again, this is for Nicole.
Okay, why don't we move on and we'll come back to Nicole.
Okay. Let's see, next is, whoops, next is Janet. Again, for Janet, I'll ask you to unmute, and if you could, for the record, state your full name and your address.
Hi, my name is Janet Flynn. I live at 55 Deering Street, right next door to Heather. Heather sort of asked one of my questions, but I'm very concerned that the kids need to have outdoor play space. And I'm wondering what your plans are for that and where that space will be located.
Thank you.
And that's it. Thank you.
Okay, thank you, Janet.
Okay, Nicole, let's try again. You should now be able to unmute, Nicole.
I lost her from my screen. Oh, no, there she's still
She's
here.
jumped around.
Okay. Okay, why don't we keep going?
Okay. Next is Kathleen O'Leary. Let me find you, Kathleen.
Can you see the raised hands? Does that help it?
I can't, oh, there we go, up in the upper left-hand corner. Okay, Kathleen, I've asked you to unmute. Hopefully you can be able to do that. Yep. If you could also state your name and address.
Okay, we have two residents here. This is Kathleen O'Leary, 81 Middlesex Ave. I am in healthcare and I do work with addiction. And I have a question for William or those from the Lowell House. What is the admission criteria? Are these kids going to be coming, you talk about getting them from home in, or is it from emergency room, or is it from a legal system?
Okay. And I'm sorry, who is the other resident with you, Kathleen?
So I'm Tracy Giles. I live at 65 Middlesex Ave. I am the abutter of all abutters. We share, my property abuts your driveway. And my question could probably be answered right now, which is, are any of the kids that are going to be accepted as residents convicted felons?
Okay, we're gonna note that down. We're gonna hold all questions till the end though. I'm just noting that. Thank you.
I do want to thank everyone.
Thank
also
you.
for holding this
Thank you for coming. Any,
Okay, we'll try you again shortly, Nicole, but Jesse Arnold is next. Jesse, if you could, yep, you're all set. Jesse, if you could state
Thanks,
your
Bob.
name and address.
Jesse Arnold, 39 Middlesex Avenue. First of all, I wanted to thank everybody who's presented tonight. It was very thorough. It was very useful. I'm not going to repeat what some other people have said. I share the question about outdoor space and where the kids will be going for outdoor recreation, because certainly that's needed. But my new question, as somebody who lives down the street, is will there be pest abatement done on the building before any demolition and remodeling, especially given the fact that it's been sitting vacant?
thank you, Jesse. Excellent. Okay.
Next, I see, excuse me, Alma Jeleskovic. Oops. It's tricky. People are moving around.
You're doing a great job.
Alma, I've asked you to unmute if you could do that. Yep. If you could give your name and address.
Sure. Hi, my name is Alma Jeleskovic. I live on 51 Middlesex Avenue. I have one question. You mentioned that some of the kids, most of the kids actually have significant mental illness. Are any of them homicidal? Possibly.
I'm sorry, did you say homicidal?
Yes.
Okay.
That all? Alma?
That's all. Thank you.
Okay.
Appreciate it.
Next, we'll try Dan Baptiste. Dan, where do I see you? I don't see you.
I saw Dan earlier. Let's see.
He's there.
There we go.
Thanks for the wave.
The real hand wave helps. So Dan, if you could unmute and also state your address.
Dan Baptiste. I'm in 71 Middlesex, next door to the great abutter Tracy. So I was wondering, as part of the renovations, I know we're all wondering on the outdoor space. It's a really like public area. You planning on building any, as part of the renovations, any privacy on that space for the kids, so it's not a fishbowl there.
Thank you.
Okay, Nicole, we'll try one more time. If it doesn't work, you already typed something in the chat. I'm happy to read it, or you're welcome to type something else. But let me ask you to unmute again, Nicole. I'm not sure why yours is different. Nicole, if you want to indicate in the chat whether you want me to read your old comment or you want to add a new one, I'm happy to read it out loud. Whoops, where'd she go?
She's at the bottom. She's unmuted.
Oh, my goodness. Oh, it's connecting.
Oh, yeah, okay. I see, yeah.
Okay,
No.
she's muted again.
Yeah, she's having a problem. I don't know why.
Okay, Nicole, we would be happy to take your question or comment in the chat if you can put
I
it
think
in.
she's on mute.
Oh,
Can you hear me?
welcome.
Yes.
we can.
Okay, perfect. Thank you. So
Nicole, if you don't mind giving your name and address.
my name is Nicole Nicosia. I live on 17 Middlesex. I would like to know further about the safety of the community, what this company is doing in regards to keeping the children who are utilizing the library maybe unsupervised, you know, sort of separated from the clients that are using this house. I would also like to know whether or not this facility will be in a lockdown facility or if individual clients can walk freely away from the property. And if we can get that in writing. To narrow it down, I would also like to know whether or not any of these minors have committed any crimes and whether or not those crimes may be considered violent.
Okay. Thank you, Nicole.
Okay, we have two more. Mike, where is Mike?
Top left.
The trouble is I have to keep jumping screens. Ah, there's Mike. Mike, I've asked you to unmute if you could also state your name and address.
Sure. This is Mike Monahan from Bancroft Ave in Reading. I live around the corner from the location. So I have a comment and I have a question. First off, this sounds like a terrific service. I think if it's done properly and responsibly, I think it's one that's much needed, and I'm glad it's coming to Reading. Speaking as somebody who has experienced addiction issues in my life with my family members, the question I have is, will the patients be allowed to leave and go to the library across the street or other public locations in an unsupervised fashion? Thank you.
Thank you.
Okay, thanks. I see one more. Larry Muse, if you could unmute Larry and state your name and address.
Hello, how are you? Lawrence Muse, Lowell Street. I just had 3 questions. Is this going to be a smoke-free facility for the kids? Is every patient going to have their own room? And is this going to be a medical detox where you're detoxing kids? That was it. Thank you.
Thank you, Larry.
I do not, oops, one more hand. Samantha Carrera. Samantha, see if you can unmute, and then if you'd also give your name and address.
Okay, I was able to unmute. I'm Samantha Carrero. I live at 44 Middlesex. I echo a lot of the comments. I thought it was a really, professional and informative presentation. My question is how long the lease is either with Cougar Capital and if you intend this to be a long-term program or if it's sort of a trial, 1 to 2 year program. So just what your sort of short and long-term plans are.
Thank you. Excellent.
Karen, that's all I see for public comment.
Okay, thank you. So I'm glad we did it that way because I heard a lot of some similar comments, and so that'll be good. We'll be able to answer that. Well, I'm feeling pretty confident that the folks from Lowell House will be able to answer a number of these. And let me ask this. Are there any questions that you might not be able to answer tonight? The pest abatement question, that's kind of a building inspector question, so I don't know if you don't know the answer to that, but maybe.
I had a question about that question. So we've been on the site a number of times, walking through with possible vendors and workers. If there's any evidence that there's a pest issue, it would be helpful to know that, but we haven't observed that. Obviously, once we start doing work, any needs that are uncovered would be addressed. I don't mean to like get into this question early, but
No, I think this is actually really a building inspector question, so I don't, it's a good question.
It really is. And I just will say briefly, Karen, we are not planning to do major renovations. We're not knocking down walls. We'll probably install 2 kitchens because we want to do separate food service, but a lot of it's going to be cosmetic and whatever the building inspector requires.
Exactly. Thank you. I appreciate that commitment.
The pest thing, every program that we have a contract with a pest control company, and we do quarterly treatments on every facility that we run.
Great. Okay.
As a maintenance.
And there's a pretty in-depth pest protocol that we have in our policies and procedures.
In answer to your question, Karen, we can answer most of these and we can answer most of them quickly. It's up to you what you want to do.
No, I think if you're ready to run with this, I did write them down. I'm sure some of the other board members did as well. And why don't you take a crack at answering the ones that you can.
All right, I'm gonna run down the list and we'll be as brief as we can. I know you're pressed for time. So I'll kind of ask our team to answer these questions. Parking. We are talking a lot about parking. There are different shifts there, so not everyone there is there at the same time. I believe, Diana, whether there are 23 staff in total, 24?
Close to 30, but not all at the same time.
Yeah, I mean, there are some that do consulting that come in. I suspect we'll have to use the parking spaces around the house. We do not intend to park in front of neighbors' houses. We will control that, but I think there's enough spaces for the core staff on a daily basis. We'll have to add on, but we'll have to work out. We can go over the grid with that and get that to people.
And
Okay.
There's not going to be a bus. There's going to be 2 small like minivans. We're going to need to take multiple kids to different places at the same time. So there's no big bus that's going to be parked there.
Yeah, we should also mention that the students don't have cars.
So does this lead into we had a couple of questions about unaccompanied clients. Will clients be unaccompanied or how will
Never.
After?
They will always be accompanied, whether it be the library, to the movie, to the park. We also understand there's not a lot of physical space there. Interesting question. I don't know whether, Dan, you asked this question of whether we want to put a barrier up. We really haven't talked about that. It's consideration. But I think on the other end, we'll probably have to use some of the facilities in town and in the other towns, parks and other places to do some of the recreational stuff we do.
I could tie it into that.
I really appreciate that question, because I got to tell you, that's the only thing when I look at properties for programs and specifically for the adolescents, we all know that they need a lot of place to run. That was the only thing about this property that I didn't like, that we don't have outside recreation. But you know what? Your town has 13 recreation areas within 2.2 miles of that property, which is unbelievable. You guys have just incredible stuff in your town. You're very lucky, and we are going to do everything we can to be wonderful neighbors and make great partnerships, hopefully. And you know, these kids are, like I said, they're from everybody's community, and they're just kids. And we will be supervising them at all times, and we'll be hoping to use some of those public spaces.
Right.
On the admission end, you asked where they're coming from. Do they come from emergency rooms? Do they come from foster homes, other places? They'll probably come from a number of locations. They have to be referred into the program. They have to have an initial evaluation. And we work with the team to get a plan for them when they come into the program. So yes, they will come from a number of locations.
But this is not a detox that got asked in the chat and in the in-person questions. So
In fact, they may come from a detox if that's, but we don't do detox. Our agency as a whole doesn't do detox.
And if somebody relapsed in one of our programs, we would refer them back to the detox. We wouldn't detox them in the program. We're not equipped for that. That's a totally different level of care.
Okay. Smoking, none of these kids are old enough to smoke, so this will not be a
No
smoking.
smoking. It's a DMH. It's a DPH facility, and there's no smoking allowed in our facilities.
And they're minors as well.
Exactly.
Well, besides.
Yeah.
Okay. Do you anticipate, one of the questions that quickly, single rooms, double rooms, mix?
It'll be a mix.
That question, you've been sitting there so nice and quiet. Can you unmute her, Bob, please?
Yeah, I'm sorry. Who is that?
Victoria Nesto, can you unmute yourself?
Victoria. Let me find Victoria. Ah, there you are. Whoops.
Oh, now she's going, bye, Victoria.
Yeah,
Oh, goodness.
I pushed the entirely wrong button, sorry. But
So did I. So I did also, my bad. I just almost tried to record it. I apologize. Yeah, so this facility will have a combination of singles, doubles, and triple rooms. There's actually regulations within DPH where the rooms have to be a certain size to hold a certain amount of beds. It will be individualized. Some people in single rooms might need that type of, isolation, or they would be, if it was like someone that had moved up in the program, they might get a single room, but yes, it will be a combination of singles, doubles, and triples. Thank you.
So, so Ivrea, I just would like to there were questions about, had any future clients had records of breaking laws? Is that a question that is appropriate to ask?
Sure.
I'm gonna let Diana handle that one.
I just want to make sure that, we have to be very careful.
Or Matt.
Yeah. Well, I think that if the kids are in DYS, I think you can assume that they've probably broken some laws. Kids in DCF and DMH traditionally are not kids that have broken laws. What they've done is they're called children in need of services, or they have a different title, and what they've broken are things that they've only broken them because they're kids and they're not allowed to do them. You can do them if you're an adult, like curfew and not going to school and that kind of stuff. So for the most part, we're not going to have any heavy hitters in this kind of a place. We're technically not allowed to ask, as far as BSAS is concerned. We're not allowed to discriminate against a kid based on their past. But those kind of kids, and in our experiences, those kind of adults don't come to we don't end up with them in our program. And we won't get them in this program either. The specific question about whether or not any kids will be homicidal, that's an absolute emphatic no. If a child is homicidal, that's grounds for being psychiatrically hospitalized, and we are not a psychiatric hospitalization. So if you're suicidal or homicidal, you'll be assessed and hospitalized in an appropriate, secure psychiatric facility, which this is not. This is considered a community-based program.
I should also mention that, and I think Diana just said it too. We don't lock the doors. We can't lock kids in. We're not that type of facility. As Diana mentioned, if a child is a fire setter or homicidal, they would more than likely go to a psychiatric, psychiatric hospitalization. We will alarm all the doors. They will all have cameras. We'll know the minute they head for a door, and the windows. It will be ligate free. I mean, we pay a lot of attention to things that kids may hurt themselves, they may commit suicide, other things. all that is we pay careful attention to and how we set up the environment.
I think we got most of the questions. You know, there was a question is how will the select board decide what is suitable or unsuitable? And I think by how, you know, we agreed to have this public meeting. We have asked folks at Lowell House to provide us an overview of their business, their nonprofit operations, which they have done. I do think they have given us lots of information of their experience and experience operating other, not exactly like this facilities, but also thank you for explaining that this was a state contract that you applied for and won. And thank you for answering the questions about the licensing.
Karen,
Mhm.
Heather Klisch has a follow-up question about the recreation outdoors.
So I think, okay, very quickly, because I think that was answered.
Yeah, it was. We are going to use the entire town of Reading and surrounding towns with the wonderful recreational facilities. Again, saying that every time a student goes out, or a group of students, they are escorted with us.
No,
Thanks. And actually my question, I did hear that. Thank you very much. My question is a follow-up to that very thing, if you don't mind. My question is this, is that kids run when, especially when they're in places that they don't want to be. We see it in the elementary schools, you know, just, so my question is, what's your experience with kids, and our outdoor recreation places are not enclosed, they are free and open. What's your experience with runners, both from the facility and from, say, outdoor programming, or, you know, when you're out on the town? What's your experience and what do you do?
Yeah, absolutely. You're right. Kids do run, and it's going to happen. You know, so there's a whole level of required training that all the staff are going to go through, as far as you know, de-escalation, verbal and physical. You know, our relationship with the police department and the other services in town is going to be really important, because it's inevitable. You know, I'm not going to sit here and tell you that that's not going to happen. It's absolutely going to happen. And we're going to do everything we can to, with our relationships with the kids, determine whether or not a kid should be going out. You know, kids aren't going to go out if they're in a volatile state. They're not going to go out in the beginning. You know, there's going to be a whole process for when they're at a point for leaving that building. And it's not going to be on day one. So it's going to be about relationship building, and it's going to be about using our knowledge and the expertise of the staff that we hire to determine when it makes sense for kids to be out in the community. And still there will be issues, because these are kids. But we'll put everything in place that we can, all the training in place for the staff, and the relationships with the community agencies to safeguard the kids and the community. If these things happen, our response will be immediate and complete. And we have policies and procedures in place for those responses and notifications in whenever those types of things happen.
And quite honestly, if they run, the last place they want to be is Reading.
That's not
Karen, if I can just ask for 1 minute, we have Jeff Winwood here. He's a neighbor, and he spent the last hour and a half staring at the screen. I can't tell you how much I appreciate that, Jeff. Do you mind if he says just a couple of words about how it is being a neighbor of a similar program, young men, but more men in their 20s?
No, thank you. I think that's an appropriate way to wrap this up. And I thank you all neighbors and residents who asked those great questions. Okay, why don't you go ahead, Jeff?
Thanks, Bill. As Bill said, I'm a retired fire chief from Lowell and a neighbor of Zach's house. And Zach's house has been a very good neighbor. In the beginning, some of the neighbors were a little bit apprehensive. So the staff at Lowell House was great. They had, as Bill mentioned, they had barbecues, they had an open house, they had a grand opening, and the neighbors were all invited, and they were very transparent. They answered any questions, any concerns that people had. And then as the project moved along, they did a terrific renovation on the house, and you know, they made it safe. It's in a great location. And then when the house was finished, they had they had a grand opening ceremony, and again, all the neighbors were invited, and people got to tour the house and see what it was like. I think a lot of people fear the unknown, and when they learned about the program and about the house and about the staff, people's fears went away. And they've been there about 4 years now. And I can assure you there's been no uptick in crime or disturbances or noise or parties or parking issues. They've been very good neighbors, very respectful. The residents keep to themselves and are quiet. And it's been an asset rather than a problem in the neighborhood. And I thank Lowell House for all their great work.
Thank you, Jeff. Jeff has my cell number and he's not afraid to use it.
No, and even the other staff members, Diana's given me her cell number and told me to report any problems I've seen, and I haven't seen any in the 4 years that Zach House has been in the neighborhood.
Cheers. Thank you, Jeff. That's really good to hear.
You're welcome.
We appreciate you sitting through this session with us.
Oh, you're welcome. Thanks for having me.
Okay. So with that, I believe we have a motion to proceed with a determination of whether this applicant is a suitable operation to run the proposed licensed treatment facility at 59 Middlesex.
Karen?
Carlo, do you have a point of information?
No, there were just a few questions that weren't answered at all that I think can be answered, if that's okay.
Okay, what questions do we still need to answer?
A few important questions. I believe it was Heather asked if a change of use can be applied for once they get this use approved. I think it's no, but if you can.
Okay, so let me just, well, that's correct. Thank you. And also, I do believe she asked how long the lease was for.
Yes.
Is that it? Okay. Thank you for bringing that to our attention. Would you mind, William, answering that very briefly?
Well, you know, in asking a change of use, I mean, we're there for a specific program. If that contract is no longer available, we're out and our program is closed. So Dan can apply for a change of use in the program, but it won't be while Lowell House is involved in the program. We're there for a specific purpose, a specific population. And you asked about the contract. It is a 5-year lease. The contract is a 5-year contract, renewable. We're doing 20 years with Dan and in 5-year increments with an option to purchase the building.
Interesting. Okay. 5-year lease with option to purchase the building. Okay. Actually, it was Samantha who asked about the length of the lease, but thank you. Okay. 5-year lease with option to purchase. Okay. Okay. Thank you, Carla. Okay. Do we have a motion?
So Karen, I think before we do that, the other question that wasn't answered and that would relate to the motion is how we are viewing suitability. And I was wondering if you want, if you want to address it or if the board wants to address that.
I'm happy to speak to it if Karen would like me to.
Yes, you may be recognized.
Thanks, Karen. So the agreement that the town executed with Dan Botwinick, the property owner, states that you have to make a suitability finding, and it outlines what the board may find as or when the board may find that an operator is unsuitable. And so in this case, it's things where the Department of Mental Health has previously revoked a license, or there's been an adverse finding by a court against the proposed property operator. And that any other considerations that the board chooses to utilize, it cannot be unreasonable. So the board's decision needs to be based primarily on factors that it believes would help it make a determination. I mean, it's not very strictly rigid, but at the same time, suitability determination cannot be unreasonably withheld.
Very good, thank you.
Would you like a motion, Karen? Okay.
Can I ask one more quick question? Sorry, one more quick question.
Carlo.
If the vote goes in favor tonight, do you have a proposed opening date?
we're looking right now at the potential of no later than January, beginning of next January. By the time we do our renovations, contractors are difficult to find right now. So we expect to go 6 months in preparation.
Thank you.
Great. Okay, Mark.
Move that the select board votes that Lowell House is a suitable tenant to operate a licensed substance abuse treatment program at 59 Middlesex Avenue, Reading, Massachusetts.
May I have a second?
Second.
Thank you, Carlo.
Karen, can I make a couple of comments?
Okay, Mark, go for it.
So as it relates to the suitability criteria, in answering your question also, Heather, some of the questions that were raised earlier by myself and other board members related to some of the specifics that Ivry had just mentioned also in terms of licensing, revocation, and things like that, just so you know that. And then the other thing is that, again, a positive or a yes vote by the board, whatever we call it here, then moves things where it relates to code and building inspection and those activities before anything would before the certificate could be actually issued. So that would kind of be, Carlo asked about the time frame, and those are some of the factors that would go into it as well. I just wanted to clarify that so that everyone understands what's happening and what follows.
Yeah, we definitely said that at the beginning, that this is does not mean that no other general business requirements that the town would have in our processes would be applicable. And we mentioned police, fire, and building inspector specifically, but not comprehensively. So yes, yep. Okay, so we have a second. So board members, as I see you on the motion, may I please have your vote? Mark Doxer,
Yes.
Chris Haley,
Yes.
Carlo,
Yes.
Anne,
Yes.
and Karen Gately Herrick, yes.
Thanks, folks.
Thank you all. We very much appreciate your time and energy to answer our questions, and we welcome you to our community. And it sounds like you're going to be a great neighbor, and we look forward to that.
Yeah, we look forward to it too, and thank you all for being so kind and welcoming. We appreciate that.
Thank you. Thank you.
Thank you
Thanks,
very
folks.
much.
Karen, do you want to try 5 minutes adjourn just to let the room clear?
I think that's an excellent suggestion. Phil, could you give us a 5-minute recess? So we'll meet back here at
8:35, okay?
Yep, 8:35 sounds good. Thank you. We're ready for the next item on our agenda. And just to repeat, I am here, Karen Gately Herrick, with other board members, Mark Doxer, Carla Bacci, Chris Healy, and Ann Johnson Landry. Next on our agenda, we have a vote on a Pride Month resolution, and I would like to open the floor to Ann Landry.
Thank you, Karen. So at our last meeting, I acknowledged in my liaison report that it was June and it was Pride Month, and that there were some activities that the library was holding, as well as some efforts that ATRAC had undertaken. In subsequent days, I noted what other communities were doing, and by and large, our peer communities, I noticed participating in flag raising events, pride flag raising events, and thought that it would be wonderful for the town of Reading to join our peer communities in that effort in recognizing the contributions of the LGBTQ community to our Reading community, and uplifting efforts to embrace the civil rights of the LGBTQ plus community. So I put together some language that I derived from resolutions or proclamations that some of our neighboring communities also adopted. I drew from Natick and Stoneham's proclamations from this year. And, you know, I'd be happy to talk about what other communities I also had seen, you know, Wakefield, Woburn, North Andover are some that come to mind that engaged in flag raising ceremonies. I also serendipitously on Saturday, while driving home from a soccer game, noted that the Gay Straight Alliance from the high school was holding a Pride bake sale on the Common. And I have repurposed one of their decorations as for my lapel pin this evening, but did have occasion to connect with them, told them about what I would be putting forward at tonight's select board meeting, and asked if they'd be interested in working, should the board adopt the resolution, on putting together some kind of program or small ceremony for a pride flag raising event at some point this month. The other good news is that after I had reached out to Karen and Bob about putting this on the agenda, Bob went right to work, and we have in fact in stock now 2 rainbow flags to choose from, 2 separate sizes. So we do have on hand in Town Hall 2 flags. So I think if the board gives leave, I'd be happy to put something together, working with community groups to organize something small for later this month.
Board members, comments? Mark?
Thanks, Karen. Thanks for putting this together, Ann. I think it's great. I think it's spot on. I wholeheartedly support it.
Thank you.
Carlo.
Thank you, and I echo Mark. Thank you, Ann. The only, I don't want to call it a concern, I guess the only, maybe a concern for the board going forward is how do we address any other requests going forward. I'm not saying we have to address that now, but I think we need to address it in the very near future. I fully support this. Hopefully I can attend if the timing is right, but I think as a board, I don't know if anyone has any comments, or if Ann did need digging on what the towns that do this already, what any kind of policies they have in place.
You mean with respect to the flag raising ceremony, or?
No, a request for another flag for a different month.
Oh, I see. So we did in this separate conversation, maybe last fall or summer, I know Bob and I had raised this with Ray, and perhaps Avery was on the call at the same time. My understanding is that the select board has jurisdiction over the town. So this is not a request that's coming from an outside group to utilize our flagpole. This is this would be, should we adopt this resolution, would be the select board making such a determination. I agree that we would have to think carefully about a policy around outside groups asking to raise the flag, because that's a different, that could certainly open up a can of worms. And so folks, one of the questions that Bob had is like, where would the flag go? I've looked at pictures from other communities. So I looked at the North Andover flag raising. The pride flag goes up below the American flag, and that seems to be pretty standard practice from the other photos that I looked at from surrounding communities.
Okay, so thank you. So a resident couldn't come to us and say, September, I want to have celebrate, XYZ organization. Can they do that now anyway?
They could ask probably, but we would have to, we may have to develop some kind of policy about how to address that kind of thing.
Okay, thanks.
Excuse me, Chris, you may speak.
Thanks, Karen. And thanks, Ann, for putting this together. Yeah, I kind of echo what Carlos saying. It's more of a legality kind of person in me, where I'm thinking that I think we do have to have a policy in place for the future, because the way that it would seem as if that we're just allowed to do what we end up wanting to do, and somebody from the public, even though we're supposed to all be equal, is just excluded from actually doing something as well. So I know there's other months, and unfortunately my daughter just got pre-diagnosed with celiac disease. So now I'm aware of, now I'm gonna have to be dealing with all these food allergy awareness month stuff and all that I had no clue about. So it's more of, I think that definitely the select board should work on a policy or a format that people can submit to and review and whatnot. And definitely something like that should transpire. But no, I fully support this as well.
Thank you. Select board members, we are in a different format tonight, and we don't have any other opportunities for public comment, but Bob did have 2 members of the public in the waiting room, so he's just allowed them to join them, and when we recess to executive session, they will not be there, but it's kind of like a public virtual meeting, so welcome. Okay, well, I think this is a wonderful opportunity that Ann has brought forward. I know we had a number of discussions over the past 12 months about something along these lines and for this specific purpose, and I'm happy to see it come to fruition. And I think the private ceremony is a great idea, and thank you, Ann, for doing the research and offering to organize this.
Sure, and I would want it to be a I say small, I mean, not sort of over the top, but it would be in our public space and open to the public, certainly.
These are new times. This is amazing. Okay, do you have a motion for us, Ann? Or does Mark have a motion?
Your secretary might have a motion.
Yeah, he might have a motion. What I meant was, did she have a motion to give to you?
Okay, wait, received. Move to approve the Pride Month resolution as written.
Second.
Thank you. Okay, board members, as I see you, Mark?
Yes.
Carlo?
Yes.
Chris?
Yes.
Ann?
Yes.
Karen, yes.
Thank you all.
Welcome.
And is there any objection from my fellow board members to my working with community members to put something together for flag raising? Okay.
Please do.
Thank you.
Thank you. No objections. Okay, great. Next on our agenda, we have 2 items that can be conducted in executive session. I understand we have, well, actually, Mr. Secretary, you could confirm whether we have 1 motion that addresses both or 2 separate motions, but we would need to take up those motions.
Let me ask town council if I could. Town council, can we have 1 motion that has both of these items listed? Is that acceptable? And also the agenda, I believe, has us returning to open session. Is that correct?
It does. That's so if we are able to conclude our response for the open meeting law complaint, I am perfectly willing to come back to open session briefly and just update the public on how we will respond. And that was the intent of that option. It is not mandatory. the board prefers not to do that.
So to answer your question, Mark, it is legal to combine it into one motion.
Thank you. Chris, you have a question?
Yeah, it's, so even though on the agenda it was split, he can still combine it like that, or?
Correct.
Okay.
Okay, you ready for the motion?
Ready.
Move that the select board go into executive session, including staff members Bob LaLasher and Caitlin Nocella and town council Avery Freed, pursuant to executive session purpose 2 and purpose 3, to vote to approve collective bargaining agreements for Reading facilities maintenance workers and town custodians. Ask Me Council 93, Local 1703, Public Works Supervisory Union, Ask Me Council 93, Local 1703. And that the select board chair declared that an open meeting may have a detrimental effect on the bargaining position of the body, and pursuant to executive session purpose 1, to discuss an open meeting law complaint filed against the select board by Walter Tubble, and to reconvene in open session after the executive session.
Second.
Thank you. Board member, Chris, you have a comment, question?
Yeah, I feel that this is a motion worth debating, if I could have a moment, please.
You've been recognized.
Thank you. I just am wondering why our prior session on this was open to the public, and the only thing that has transpired since then, when we had the open meeting, is only my text between Karen that was brought up and my communication with her. So I'm wondering what the difference between then and now is, because I'm perfectly fine with having any of my communications out there. And I'm just wondering why it wasn't included in the packet either, the text message that I provided. If Ivrea can speak to that.
Ivrea, would you like to address that?
Yeah, for sure. So I think to answer your first question, it's always my office's advice that open meeting law complaints or complaints against public bodies be held in executive session. With that, it's the board's decision, and we recognize that there may be times where it's appropriate to discuss a matter in open session for non-legal reasons. The advice here is that considering there's additional facts that may support a finding of a violation, I'm not saying there was or wasn't one, that type of conversation is better had in executive session. So from my perspective, from a legal perspective, my job is to protect the town, and our office prefers to have those conversations in executive session. I think in regards to the text message, Karen, if you'll allow me, I mean, that doesn't exactly fall within the scope of the motion that we're debating, but it was not sent to a quorum of, to all members of the public body. So in accordance with your communication policy, it wasn't included in the packet. The board can choose to release that communication if it wants to. And when we're directed to, staff will follow the wishes of the board. I want to be clear that I serve the board and I serve your interests. I don't decide what those interests are. So whatever the board decides, whether you decide to go into executive session or decide to stay in open session, that is fine, and I will carry out your wishes. I'm just giving you my legal opinion here, but this is a decision for this public body to be making.
So since my text wasn't included because of that reason, why was Mark and Karen's text included then? Because it's the same scenario.
Point of order, yes.
That's not part of the motion that's being discussed here.
Okay, thank you.
But even though Ivrea just brought that up, I'm not allowed to speak on it?
I think that I was responding to your direct question. I think that if we're the motion that is on the floor is going into executive session. So I think we should keep the matter to that.
So in full transparency, that's why the last meeting was transparent, and it just gives the impression now that what we're doing is
I
just—
gotta raise the point of order again.
Chris, we have the motion on the floor. Do you have any concerns about the specific motion, or we can vote on the motion, you can vote against the motion?
I do have lots of concerns about going into executive
so-
session.
Okay, understood. We have heard you. Anne, you raised your hand?
I support going into executive session. I don't, I have appreciated that the board does have a very strong commitment to transparency, but I don't think that our conversation last week in open session served the interest of the town and the community. And I think that this will allow us to have a conversation where, for example, there were some matters that were subject to attorney-client privilege that were not appropriate to be discussed in open session, but we may be able to get answers to board members' questions and concerns in executive session, which would be the appropriate forum. And I think it will allow us to have a conversation that is sort of provides less opportunities for sort of like everyone on TV being performative. And I think it'll allow us to think through very carefully and in consideration for each other what is in the best interest of our community, and will allow Ivrea to provide the facts as she has collected them over the last few weeks.
Do we not agree that full transparency is in the best interest of the entire community?
That's not,
order.
that's not, thank you. You need to stay on
Folks,
the motion. Sorry.
So am I able to have a point of personal privilege then?
No,
Am I able to do
we're
that?
discussing a motion right now, and the motion before us is, we have two items, the very important business of the town that we have proposed to be conducted in executive session. The second item under advice of town council. So if you disagree with town council, that is absolutely your prerogative. Anne.
One other aspect that I hope folks who, transparency is very important. There are other interests as well at play, but in the interest of transparency, I believe it is the intention to return, and correct me if I'm wrong, but to return from executive session to public session following our executive session. Is that right? So we would have an opportunity to report back to the public immediately.
But then anything that we said in executive session is covered by.
So Chris, we can talk offline about how executive session works if you like. Okay.
I personally think it's being used right now to hide stuff from the public. That's
Chris,
my
please.
opinion. Thank
Point
you.
of order. You know what, folks? This isn't okay. This is not a discussion that can happen this way. It doesn't relate to the article that we're talking about here. Chris, I hear you've got some strong opinions. They're not relevant at the moment. They can't be played through. And I resent being called out for not being transparent. That's not okay.
I didn't specifically call you out on that. I don't
feel you
believe that.
called out the board, and I don't think it was appropriate. Unrelated to this issue at all.
Okay, so we have before us a motion, and are we ready for the vote? Carlo?
Thank you. I agree with Ann's comments, and I'm not an attorney, and I just feel that a public complaint should be aired out in public, and that's all I'm going to say. Thank you.
Okay, thank you for your feedback. Board members, if we're done with deliberation on this motion, I'd like to ask for a vote. As I see you, Mark Doxer,
Yes.
Carla Bacci,
No.
Chris Haley,
No.
and Johnson Landry. Oh, she's muted.
She needs to be unmuted.
Yes, apologies for muting myself.
And Karen Gailey Herrick, yes. So we, Phil, we will adjourn to executive session. And it is our option, if we have resolved this complaint, to return to open meeting and briefly respond and update the public in the interest of full transparency. Thank you. Reading Select Board, we are returning to open session for the final item on our agenda for 6-9. And at this time, we have agreed upon a response to the open meeting law complaint scheduled for 8:40. We have instructed town council to craft the response to the complainant and follow the other protocol as specified by the Attorney General Office and open meeting law. We will publish our response in our next select board packet. We have also agreed as a board that we will revisit our communications policy and we will recommit ourselves to adhering fully to open meeting law. Okay, may I have a motion to adjourn?
Motion to adjourn.
Second.
Board members, Mark,
Yes,
Carlo,
he's muted.
you have to unmute Carlo. Bob has to help you.
Bob's muted too.
Are we good?
Yes.
What am I saying? Yes?
Mark voted yes to adjourn for the evening. Would you like to adjourn for the evening, Carlo?
I do, but I want to talk about when we're going to meet in public. Can I do that?
We are taking a vote
Yeah, I know.
on a motion to adjourn, so,
I know, I can't. All right, yes.
okay, Chris,
Yes.
Anne,
Yes.
Karen. So we are adjourned. Thank you very much for your hard work tonight. Thank you, Phil.
Folks.
Okay.